Hello, my name is Mi-Young-moon. I'm working for the Department of Nursing at Jungbu University. I will start presentation. The title of this article is The Effect of Rudeness Experienced During Clinical Practice by Nursing Students on Critical Thinking Skills, Problem-Solving Skills, and Clinical Competence. And next, the following is the lead for research. Through clinical practice, nursing students can apply the nursing theory they learned at university to clinical practice or experienced their role as nurses firsthand. In other words, they learn about nursing knowledge and how to apply nursing skills and establish their identity as professional nurses in advance. Clinical practice is considered a very important element in the curriculum for nursing students. In clinical practice, nursing students can apply what they have learned to the nursing field, which develop their potential and foster creativity. Therefore, nursing students should have clinical competence in which nursing knowledge and clinical practice are integrated based on clinical practice education and theoretical education. To future nurses with a certain level of nursing competence, it is required to develop the clinical competence of nursing students. At this time, to improve clinical competence, desirable teaching efficiency, and optimal clinical practice environment should be well established. It is important for nursing students who should face the clinical field to improve their clinical competence. To improve clinical competence in nursing students, it is not to manage a variety of factors that can directly affect their competence. And next, critical thinking tendencies have emerged as another factor influencing clinical competence in nursing students. Critical thinking refers to rational and logical thinking to solve problems through creative thinking, correct evaluation, and good judgment. Critical thinking skills are not only an important indicator of nursing education outcomes, but are also suggested as an important factor influencing the clinical competence of nurses. Nursing students' critical thinking tendency can be an important influencing factor in improving their clinical competence. In particular, clinical decision-making necessary to think critically and select appropriate alternatives in performing nursing according to various clinical situations is necessary for nursing patients. Nursing students also experience this respectable behavior such as ignorance, indifference, unpleasant expressions, sophist behavior, sarcastic behavior, and bothersome expressions from nurses in practice. As a result of examining the result of study conducted by Hong Yoon-kyung, it was found that 17.5% of nursing students experienced rudeness during their clinical practice. If nursing students perceived loud behavior from nurses during clinical practice, their stress increased and their many experienced helplessness in reality that they can be do anything. And next, research design. This study is a descriptive research study to identify the effect of rudeness experienced during clinical practice by nursing students on critical thinking skills, problem-solving skills, and clinical competence. And next, subject of analysis and data collection. The subjects in this study were nursing students attending on one university located in the K North Province and one university located in C South Province of Korea from December. This study conveniently selected third grade students who completed 6 weeks or more of clinical practice. For the number of subjects in this study, G-Power 3.1 software was used to calculate the appropriate sample number. With the significance level 0.05, power 0.95, effect size 0.15, medium, and 11 predictors. The minimum sample size required for multiple regression analysis was calculated to be 178 people. This study selected 220 people in consideration of their dropout rate. And next, research tools. Rudeness tool. Rudeness refers to a score result in using in KUBCNE tool, adapted from the uncivil behavior in clinical nursing educator and adapted by Suk-jo. The tool for this study was Jo-Suk-ok total 30-item questionnaire, which used a 5-point Likert scale. Scores range from 1.4 never to 5 point per very often, and the higher the score, the higher the degree of rudeness experienced. Cronbach's alpha for this tool was 0.8584, which was 0.919 in this study. And next, critical thinking rudeness. This study used a tool for reasoning critical thinking tendency developed by Yoon-jin for nursing students. It consists of a total of 27 items. Each question consists of a 5-point scale, and higher scores indicate higher critical thinking tendencies. And Cronbach alpha was 0.84 in study by Yoon-jin. The next screen shows problem-solving net skill. This study used a tool modified and supplemented by Woo-ok-hee. It consists of a total of 25 questions and can be divided into 5 sub-areas: problem discovery, and problem definition, and problem solving, and problem execution, and problem solving review. Each question is one of 5-point scale, where the higher the score, the higher the problem solving ability, and Cronbach's alpha was 0.89 in the study of Wu-Oki. The reliability of Cronbal-Pap for each subdomain in this study was 0.763. Problem definition was 0.700. Problem solving was 0.813. Problem execution was 0.650. Problem solving was 0.784. The problem solving review was 0.785 and Cronbal-Pap for all questions was 0.917. First tool, clinical competence. In this study, the 6-dimension scale was modified or supplemented by Joe Misuk and used for measurement. It consists of a total of 45 questions and consists of a nursing process. In this study, nursing score was Cronbal-Pap were 0.9059, nursing technology was 0.909. Cronbal-Pap for overall question reliability was 0.967. Next, data analysis method. The collected data were analyzed using the SPSS 21 point program. The general characteristic and degree of rudeness, critical thinking, tendency, problem-solving skills, and clinical competence of nursing students were analyzed by the frequency percentage and mean and standard deviation. Differences in rudeness, critical thinking, tendency, problem-solving skills, and clinical competence according to general characteristics of nursing students were analyzed by t-test, ANOVA, and SAPR. In this study, a correlation analysis was applied to identify the correlation between rudeness, critical thinking, tendency, problem-solving skills, and critical competence of nursing students. A stepwise multiple regression analyzed method were applied to the study to confirm the effect of nursing students' experience of rudeness of their clinical thinking tendency, problem-solving skills, and clinical competence. Result. Regarding the response to whether they experienced the rudeness from nurses, rarely account for the most with 35%, followed by never with 26.6%, sometimes 20%, and often with 17%. Regarding whether they have experienced rudeness from doctors, 45% answered never, 43% answered rarely, 9% answered sometimes, and 2% answered frequency, 44%. The difference in rudeness according to the general characteristics of the subject were analyzed. The results were as follows. Satisfaction with nursing is a major. Rudeness experienced from patient or guardians. Rudeness experienced from nurses. Rudeness experienced from doctor, and the rudeness experienced from the staff was significant. The result of the difference in critical thinking skill according to general characteristics in study was follows. Gender, satisfaction with nursing as a major, satisfaction with clinical practice, satisfaction with interpersonal relationships, their experience of rudeness from nurses, the experience of rudeness from doctors, and experience of rudeness from staff were significant. Next, Result: the subject degree of rudeness, critical thinking skills, problem-solving skill, and clinical competence was followed. Rudeness can be divided into subdomain of execution, contempt, and rejection. The mean of standard deviation from rudeness was 1.51 point. Exclusion was 1.73 points. Contempt was 1.43 point, and rejection was 1.26 point. Critical thinking skills scored 3.71 point. Problem solving skill scored 3.69 point, and clinical competence score 3.68 point. The correlation between subject rudeness, critical thinking readiness, problem solving skill, and clinical competence was analyzed, and the results are as follows. There was a positive correlation between critical thinking skills and problem solving skills, as a positive correlation between critical thinking skills and clinical competence. There was a positive correlation between problem-solving skills and clinical competence, and there was no correlation between it and rudeness. And next, factor affecting problem-solving skill include satisfaction in nursing as a major, critical thinking skills, and clinical competence, which showed 55.8%, explanatory power. Factors affecting clinical competence include satisfaction with clinical practice, interpersonal satisfaction, rudeness experienced by staff, and skills, problem skills, which are had an explanatory power of 39.2%. And next, and the next screen shows conclusion and suggestion. The result of analyzing difference in rudeness based on general characteristics of the subject show that they were significant in terms of satisfaction with nursing as a major, experience of rudeness received from patients or caregivers, experience of rudeness received from nurses, experience of rudeness received from doctor, and experience from rudeness received from staff. Students who said they were more satisfied with the nursing department being their major were more likely to experience rudeness than those who were generally satisfied with their major. Students who are highly satisfied with their major in nursing are considered to have a lot of interest in nursing, and therefore they are likely to react more sensitively to rudeness. Therefore, in the future, it is true that repeated research will be necessary to include behavioral and nonverbal thing and consider that there are maybe differences in cognition. There was a positive correlation between problem-solving skills and clinical competence, but no correlation with experience of rudeness. Considering that the score for rudeness proposed earlier and low, it can be assumed that critical thinking skills, problem-solving skills, and clinical preparation were not affected. It is necessary to understand the degree to which rudeness is perceived individually and to what extent is not rudeness. This part should be educated through the education of clinical practice in the field of clinical practice. It is through that it necessary to help develop programs to prepare for experience of rudeness so that students' professional self-concept can be formed correctly by maintaining continuous and irregular exchange between clinical advisors and experts in the clinical field. Therefore, to achieve systematic and efficient clinical practice education, it seems that a multifaceted effort of industry, academic cooperation involving clinical field leaders and teachers dedicated to practice will be necessary so that a practice program that takes into account the environment of clinical practice education is well prepared. Thank you very so much. I'm going to finish the presentation. Thank you for listening.